Guest.
How are you? Again, if it's Thursday, it's usually when we talk to members of the medical community. Today, we're talking about one of the tools used to help fight obesity. That would be bariatric surgery. This morning, Dr. David Miles is in. He's a bariatric surgeon with New Hanover Regional Medical Center, talking about the risks and the myths of the surgery. Let's start right off the bat with who's a candidate to have this type of a procedure?
Anyone who's 75 to 100 pounds overweight is likely a good candidate.
Okay. And I know right off the bat, in some of the information that was sent over to us by Aaron, who's right off camera here, there are some myths that are out there about this type of surgery. Can you kind of break those down
Sure.
and dispel them at the same time?
Well, you know, one of the myths is that it's too drastic. And honestly, staying morbidly obese is drastic, has a 5 to 10-fold increased mortality rate compared to the surgery. So the surgery itself is really not drastic. The other myth is that it doesn't work. And we now have 10, 15, 20-year data where people on average keep 100 pounds off. So it does work long term.
How invasive of a procedure is this for somebody?
It's a one-night stay in the hospital now.
It's amazing. Every time we have a different physician and talking about surgery, I'm amazed now how quick of a turnaround it can be for people.
Yeah, it's the safety record now puts it on order with appendectomy, hernia, gallbladder surgery. So we've really made some great improvements.
And when you talk about someone being 75, 100, 150, whatever pounds overweight, are they so far past just being able to do diet and exercise to help get that weight off?
Yes, exercise remains the single most important thing anybody can do. And the problem is if you're more than just overweight, when it's 75 pounds, you're not going to get that off with a diet. And studies show 95% of people regain all the weight and more. And so if you find yourself in that situation, continue to exercise, but start thinking about the surgical weight loss.
When you have a surgery like bariatric surgery, you've come out of the hospital, you're now getting back to your day-to-day life. Is it immediate, and what do you feel after having this surgery when it comes to eating? Is it just a quick reduction of appetite?
No, great question, and yes, the appetite is diminished instantly, and people still enjoy eating, they're still able to eat, they just become satisfied after a normal amount, or what I would call a normal amount of food. And so it's not painful, it's not difficult, it's very easy.
I know, you know, we always joke at like Thanksgiving time how you kind of put things away and your stomach continues to grow as you eat that food. I would have never realized that just by shrinking the amount that you can put in immediately reduces your, I guess, want to bring food in.
You're getting really complicated now. There are a lot of what we call gut hormones,
okay,
and the surgery helps change those, and there's a feedback to the brain that tells you you've had enough to eat, and so part of the surgery is just changing that. But people that have the surgery, they are still able to eat. They can still overeat if they were to choose to, just they don't want to.
Wow, it's fascinating to me.
Yeah.
You do great work. I mean, you just like literally just blew my mind with that.
Good. I hope we can continue to help a few other people.
Yeah. All right, Dr. David Miles, I appreciate the time. We're back with more after this.